Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to discuss today a problem that took me quite a while to figure out what was causing this type of malocclusion, where the bicuspids were kind of sucked in on the sides up here. And I finally realized after waking up one night and about halfway awake, I noticed I had a tremendous vacuum sucked in my mouth. And if you have a good seal and you swallow once, twice, or three times, your tongue will go back and it'll pull a vacuum in your mouth. And that's the way of course, you suck stuff out of a cup with a straw, or somebody nurses, or what the baby nurses. This is pretty well developed. And this was what was happening, and I was pulling that in, and because your bicuspids are weaker teeth and they close in. So let's discuss that and look at this young lady that I'm going to show you here. She's got a straight profile and good facial structure, both looking straight on or on the side. And then you look at her teeth. Now just look at where these bicuspids normally would be coming down out here. They're headed like tilted in like this, and these are tilted in. The molars are tougher. The cuspids are longer rooted, and they don't go in as much as that. And over on this side, the same thing's happening. These teeth are leaning in like this. And then there are other things. He's got a little deep bite and a few rotations, and I'm not going to talk about them too much. We're just going to talk about the this pressure pushing these bicuspids in. Now, most of the time, when somebody's like this, like the upper molar teeth are fitting inside the lower molars, and that's not the way they should meet. In other words, your lower molar should be like this, and your upper molar should cover like that, and that keeps the jaw from biting. Somebody like this, they'll bite their jaw down here, and on this left side of the mouth and on the right side, I think it was correct as far as that was concerned. Over on the right side, we'll take a look over there, and it is over here. The upper cusp are out over the lower teeth, and that keeps the cheek from going in here. And this is in a good class 1 relationship. So you got contact back here, and you have these teeth coming down in the grooves, and this part over here looks good. And you get out here at the front, these teeth have over erupted, and we got a kind of a deep bite, and that causes crowding in that area. Now let's look just straight at the case. Of course, you got some rotations in here, and you need to line that as you intrude these teeth right here. It'll give you some more room. But look where these bicuspids should be, out here. Now you can move them out there, and the teeth move, and they take their bone with them. And that's something that happens all the time. And we were, surgeons were taking the mouth apart a lot of the times, said that you can't put a tooth there if there's no bone. But if you just gradually move the teeth out, the bone structure moves with the teeth. If you, especially on the sides where you don't have anything pressing. Now down on the lower anterior, down here you have real strong lip pressure sometimes. Some people pull back, and if you're going to expand these teeth and move them forward in that direction, you've got to run a lip bumper in here to run interference for them, so that you can have a soft vascular bed for the bone to form as the teeth move out. If you don't do that, you will strip the teeth. And there on the sides, you have very little problem with that. Now these down here weren't tilted as much. This is where we had the bite. The top teeth were closing over here. Now over on this side, the upper cusp came over and down, and here it came up, and that it's not quite as far off as it was. But anyway, these teeth are in, and these are too. Now we'll go ahead and go to the next view, looking at the, this is the first Panorex we took on this young lady, and she's 18 years old, almost 19, when we apparently started this case. And you can see the bites are closed. Here the lower teeth went up to here. I took everybody doing a Panorex and didn't have them bite on anything out here. We let them close their teeth like they normally would, and that would register how much closed bite you got. And you could also see if this is in class 1. This is not class 1 over here. This is off some extent. Now let's go and look at this. We went in and we put an intruding wire here. We've got videos on that, and we put the brackets down kind of low on those teeth, and we're bringing those lower teeth down, and we put some curve in this upper arch wire and brought it down and tied it. It'll tend to straighten this out. Now you can't see how the teeth fit together. Now this, at this point, she's 20 years old, see, 20 and 2 months. Now here it is the third Panorex we took in 91, and she's 22 years and 3 months old. And the side over on the left is in class 1, and this is in class 1, and the closed bite is corrected, and she's holding up very good. Everything is worked out fine on that particular case. There we were when we started in 1987. She was 18 and 9 months, and there it is, 91, and she's age 22 and 3 months. And the teeth are sitting in here with the nub just about the right amount of overbite and overjet. And we seemed like she may have had a slight TMJ problem, but we took transcranial x-rays, and you can see if you bite, the condyle is up here, and you relax, it's here, and when you open your mouth, the condyle moves here. And this is the fossa, this is the ear, this is where the condyle fits. As you open your mouth on one side, if you just do it on one side, this will stay where it is, and the other will twist. It'll twist one of them to do that. But we got our TMJ working fine, and now this is the showing you how we did this now with these single brackets, and we've got this intruding wire here which comes off and is way down like this. We bring it up, hook it this on top of your regular arch wire. If you look at this close, I'll erase that. You can see the regular arch wires in here, and this is your intruding arch wire. And it was down like this, and we brought it up and hooked it to these teeth, and it brings this down and pushes this up a little bit, but the occlusion bites down and keeps it in place. And we've got a little more space over here. This is the side that was wrong, and we had to jump that over. See this, the upper teeth were fitting inside of the lower teeth, so we had to put a block on there to jump that. And while we were working on it, these teeth came together on the other side of the mouth. That'll do that in a few months' time. So when you first put the block in there, your teeth are setting up like that, and you close it on one side. Now over here, here's this block. We had to bring these teeth out over the lower teeth down here, so that the upper cusp now on these teeth will be out over the lower cusp, and that protects the cheek in here. So this is coming across, but we had to put something on top of here to jump it over there. So we're good to go on with this. and we got it lined up now, and everything is looking good. We got this over the hump, so we'll take that block off. You just cut a groove down the middle of this and piece it together. This is a rather soft acrylic, and it's not bonded on all that good. And so when we first do that, take that out, these teeth are together, but these are apart, and then these teeth will move together. So learn how to use those blocks. That is a great help in doing orthodontics. Now we got the midline good, the teeth are brought out on the sides, and we'll go ahead, and that's back in class 1 on this side and almost together over here where we had the blocks. In just a couple of months, these teeth will come together and the thing will be leveled out. And if you have trouble believing that, you just have to try it. It works. And there we are, everything's lined out, the teeth are lined good, and here she is in 91, and the profile and the vertical dimension in here is good, everything looks fine, and this is the anterior portion in here, and that's her smile, and there the teeth are. There we were when we started, that was down like this, and these were doing in, and here it is after we finished. It's straightened out, like these teeth were down here somewhere, like that. Now we'll go on to the other side. They're curved in like this. And if she wears her retainer and gets over this period where she sucks, puts this cheek pressure in here, pushes these teeth in right here. Now there it is after we finish up in 90, well this is 91, this is a good while after we finished. There's the way it was when we started. The upper teeth were inside and these were outside. This is a mouth breathing problem where you got your tongue down here and you breathe through the mouth, and the tongue presses these teeth out and your airway is reduced when they come in. So this is out straight. Let me look at that again. Let's see. There it is after it's out there. There it was down. Now there it is after we finish the case. And so the bone is on these teeth. And this is ridiculous to think that you can't put teeth over in an area where there isn't any bone. If you just gradually move those teeth over, the bone goes with the teeth. Now if you try to if you're using this Big Daddy arch wire, you've got to learn how to put buccal root torque. You can't pull those out without, if you don't do that, the roots will go in. There we are, closed out. That's 87. Now, see how this does. Let's look at the deal straight on the other way. Now look where these teeth are. You see, we brought them out, and if she'll use this, she'll get where she just sleeps in it. The bottom teeth close right in here, and this will end up, she may have this the rest of her life. She'll have her teeth lined up good. There's where we were when we started. There's where we are when we finished. That's 91. Now that's later. I mean, that's a few years out of case. There it is, closed now at 90. I think that's 91. I believe that's 94. Something like that. So we watched her. That's 94. It's still holding up, you see. So that's her retainer in 94, and the teeth are lined up like that, and she's held, this is held good, that little groove those teeth fit in, and this is staying, and the pressure is staying in good shape, and this is several years later. Now, I appreciate you watching these videos, but I'm getting so darn old, and I'm sure it sounds terrible. My voice doesn't work too good anymore, but I want to get through things that I never heard anybody read anything about. Vacuum pressure up here, pushing the teeth off. So we started this back in the 70s or 80s in there, and I got this working. And so we're going to go through everything that I think we did the first ones several years ago, and I've got records back 30 and 40 years on some of them. So I'm glad you're watching this, and you can do these things. And I want to train dentists who are doing orthodontics, and there are a lot of orthodontists around the world that can benefit from this. So thank you for watching, and I want you to join our group and subscribe to our channel. So I'm going to say goodbye and close this thing out. If I can get this mouse to work.